um, live on
Huh.
YouTube, and then I'm gonna go ahead and go live on Instagram.
Okay.
And then at the top you should see those round
Mhm.
icons, and it should have the one with the sickle cell 101 on it, and it should say live at the bottom. Hi guys, we're back to talk about a study called SCDPain, and I have a very special guest with us, and we'll try and get him on. If you have any questions about pain or any questions that you want to share
Pain.
with us,
A lot
feel
of
free
pain.
to.
I have a lot of questions about
I
pain.
Yeah, I have a special guest, and he is actually my sickle cell provider. So y'all go ahead and grill him because he's
Yeah.
he
Yeah, I'm
knows a
looking
lot.
I'm looking at the circles.
Okay.
I see your
And then
story.
if you push it down to refresh it, it should
Ah,
say live.
bingo. You're so there you are.
All
Okay.
right.
Now we're live.
Hi. Let me see if I can invite you. Yes. Okay, I just sent you an invite.
Invite to
Hopefully it
Oh, here
pops
goes,
up
here
on
we
your
go. Go
screen
live.
there.
Okay. Continue.
Hello, hello. Happy
Hello.
Friday. We are bringing on Dr. Robert Ward Hager. Oh, I hear a little
Hey,
echo. Let me see. Can you hear an echo? Let me
am
know
I
if
on
you
the
guys can
camera
hear an
or
echo or
I'm on
not.
my Zoom, I guess. I'm on one or the
So,
other. Can
yeah.
can people hear me?
Yes, we can hear you, Dr. Hager.
Thank you so much for spending some of your Friday with me. Sickle cell pain is it's such an important topic and it's so poorly understood. We have very poor, not great treatments for it. The ones we have their issues. And to start to address this, I just wanted to inform everybody in the community that the National Institutes of Health, through the National Center of Complementary and Integrative Health, has funded a 3-year study, which actually started last year, with the idea of bringing in um, different divisions, not even hematology or pain perhaps, but looking for anything that can help bring into a holistic approach for pain. Um, it has several main parts. One is innovative measures and methods to study pain, because we don't even have good methods to know really how much a pain is and what types of pain they are. Also, there's a whole section and groups working on novel insights into how pain affects organs and organs affect pain, which is what I'm working with. And then also another group working with whole person health approaches to sickle cell pain. And along that, we're also running pilot projects, which we're reviewing and actually have our first session next week to give some awards for people doing really innovative work, somewhat outside the box, looking at sickle cell pain to see if we can get a better handle on how to help. And a whole nother group looking on training and dissemination about getting the word out about what we're doing and the results that we find. So I just wanted to let you know this, and also for our group, after about a year of meeting, we've divided into 5 groups that we're focusing on. One is oral and dental pains. Another is
Oral
looking,
and dental?
yeah, we have a lot of
Oh,
patients that have jaw issues and teeth issues. We've worked with the dental
interesting.
institutes in New York City about, um, it's when you actually start looking at how many people you have, a lot of times it's not even brought up and how it affects things. We've had a couple of patients even have scurvy and actually lose teeth.
I don't know what scurvy is.
It's when you don't have enough vitamin C and things just
Oh,
don't
okay.
form well, and it's such a rare disease in this country. But once again, folks with sickle cell don't get a break. Things can sneak in. We have another group that's doing really good work with GYN pain and obstetrics pain. Um, and then we have a whole nother group looking at the vexing issue of once some people actually get gene therapy or transplant, and their pain doesn't get a lot better. What's going
Yeah.
on with that, and that we can kind of work with. And the 2 other groups left are one is kidney related pains, because kidneys are one of the most affected organs in the body, and just the interaction between those two. And then the last one that Dr. Buczynski and I are working with is the relationship between bone pain, AVN, and all the other treatments that go on. because it turns out no one's really well studied the nerves that actually go into the bone. We think of bones almost like solid tubes, but they are just chock-a-block full of really specialized nerves. And
Mm.
interestingly, the same signals that signal bone growth actually signal bone pain. So maybe there is something to growing pain. So anyway, kind of looking at all this, we're coming up, finally getting our groups off, and really just like two more slides or two more things to mention. For the oral and dental pain, there's a manuscript coming out talking about trying to put a roadmap on for research in the dental disorders and sickle cell. There is a Lydia Pecker's, the dental is being run by Joan Beckman at the University of Minnesota. Um, and Lydia Pecker at Johns Hopkins has been doing great work with pain in the reproductive cycle because we all know that it's so understudied,
Yeah.
very, very real. And she actually has a manuscript that's being reviewed by Lancet, which is a major medical publication now, just trying to figure out mainly where the gaps are. We realize the first thing we need to do is figure that out. For the post-transplant pain, um, Krish Lakshmanan, who's actually one of the major transplanters in the country, has been reviewing over 200 published articles about what's going on with this and trying to figure out approach to it. And probably the furthest along is kidney-related pain by Samit Ghosh and Santosh Saraf. They actually have a couple of manuscripts that they're publishing about what seems to be driving this. And then Dr. Paczynski and I are still looking at it, how best to approach it. We found some really good review articles looking at some things that people really haven't thought about bone pain before. So having said that, we're actually coming up with a special issue of a journal called Hematology, which is one of the major journals that's just going to be focused on novel approaches to sickle cell pain. And that'll, we're just starting that, so hopefully we'll have the manuscripts out at least in line to be published in about 6 months. So I just want to let people know, even though it may not seem like a lot's going on, this is just one of many groups that are really trying to go back and figure out what we really need to look at differently to hopefully improve care. Because what we have, we're grateful that we have it, but I guess everyone will
Yeah.
probably agree it's not exactly where we want to be with like pain control.
I think just even identifying all of these sub specialties within pain is a huge step because for so long pain has been grouped as kind of one entity. And so now we're
Mhm.
separating it into all of these different entities within sickle cell.
Yeah, it's funny you said that because for a long time when people call me and say they have pain, my first question is where? Because
Yeah,
it's just like
yeah,
one thing. And when I write my notes, I always have an S on pain because I think it's many, many parts coming together. And it's driven by many different, some of it's occlusion, some of it's inflammation, some of it's amplified by actually the meds you take. And anything like lack of sleep can amplify pain, trying to figure out the different components that make it bad. So we can actually hopefully tailor treatment better so people can get more acute relief from pain.
yeah. And is the study are these like publication reviews essentially?
Well, they're both. And one of the things that I mentioned quickly, because I didn't want to take everyone's time, one of the things we're actually doing besides getting a gap papers out for everything is we have a call out for research proposals, and we're actually reviewing a bunch now that we'll be giving small pilot grants to start research in some of these areas. And then we actually even have a sabbatical for junior faculty that are interested in this. We'll pay them to go somewhere and actually study different aspects of sickle cell pain. We're taking applications for that too. So it's a kind of a it's far-reaching system without, it's not like
Yeah.
a focused study of, oh, we're going to see if this works for this. We're just trying to increase the number of people that have an interest and giving them some space to actually have an interest in improving sickle cell pain care.
Yeah. Um, and how long is the study going to be for?
It's a 3-year study at present.
A three-year study. Okay. And we started last year?
Yeah, it started last year, but then we got kind of
Okay.
waylaid by the government shutdown. I'm not sure if they're going to kind of take that time out. For a while, we couldn't meet and stuff, and they were trying to sort things out. But
Yeah.
so we'll really say it like we 3/4, half a year. We've been going for about half a year, and then this is where we are now.
There's somebody saying that they're having pain crisis right now and their eyes are extremely yellow. Where does crisis fit within those subdivisions?
Well, crisis is an interesting. One of the things we're trying to do, and sorry to hear you're having pain, And the fact your eyes are getting more yellow lets us know you're probably having what's called a typical hemolytic crisis, which means your sickle cells are falling apart a little bit faster than usual. And when that happens, all the stuff that's inside the red cells that gets dumped into the bloodstream where it doesn't really like to be, and it really irritates the very living lining of the blood vessels, the endothelium, and then that releases a bunch of chemicals, and that's where the pain comes from. And so usually
Mm,
when we see that, it's just one of the many ways it drives inflammation that's really bad and kind of hard to treat. Often, hopefully, if you have at least some approach to management that can make it tolerable. And this is one of the areas where um, some of the some of the things they're looking at. There's actually a study going right now where they're actually infusing something called hemopexin because one of the major things that irritates the body when you have a hemolytic crisis is the free hemoglobin that's coming out of the red cell floating around.
yeah,
And we all make something called hemopexin that kind of binds that up. But when you have a crisis, you overwhelm that system. And there are a couple of groups that are just starting studies with actually just infusing hemopexin, seeing if they can actually block all of that right away. Will that acutely help the pain? Those studies really have just gotten started, but we should have some data within the end of the year about that to see if that would be like an acute IV treatment for this type of sickle cell pain. Notice I said type because, as Sandra, you noted, there are many, many factors that drive it. And this is, unfortunately, the kind of pain that the ERs often are looking for that aren't too informed because they really can see a change in this will go, aha, you're hemolyzing, so you probably do have pain. Obviously, we know that's not true. You can actually have a lot of pain without hemolyzing, but this sounds like a typical pain. And the yellow, as you know, is just the fact it's just a sign that the red cells are falling apart and the bilirubin levels in your blood are rising. It doesn't hurt anything directly, the bilirubin, but it does, make the eyes and the urine yellow when that happens.
yeah, yeah. Well, wonderful. Anything else you want to share about the study, Dr. Hager, or does anybody else have any
Yeah.
doctor or have any questions about the study that Dr. Hager's talking about?
Well, I just wanted to, make sure people knew that we're still working on things, and even though half the time you only hear about final studies, there is a lot that's going on that's hopefully will lead to some final studies. And a lot of research, you have to kind of do things like this, is like front load it and really get people interested and give them some funding up front so that in a few years we hopefully will have something coming out of it. Because you're just not sitting in a lab going, aha, I just figured out something great. And one of the main things about this is we're really getting people in that aren't hematologists or pain doctors or really working in this. One of the interesting things persons we've connected with is someone who's actually doing MRI studies of people in pain and looking at the connections and things that are lighting up. And it's really interesting because they're not the usual pathways as you think about. So these are some of the novel ways we're trying to look at this to be able to now go back and say, okay, now how can we interfere and help these pathways if we know it's a little different? Um, and so that's part of the whole idea of this is we want to see where these really out of the box studies, they have medical validation, but they're a bit out of the box and see if they really can inform what we need to do for the next set of much really, really focused sickle cell pain care.
Yeah. You did mention AVN as one of those subcategories, and this person says they have AVN in their right shoulder and hip, um, but had surgery for it already. Does AVN cause you to have more pain crisis?
It
Are
may.
the two correlated?
Yes, very much so. And one of the vexing parts about, I'm sorry you have AVN, but about 30 to 40% of folks with sickle cell will eventually get some AVN in a joint. And sometimes it sadly starts very young. In our pediatric program, there's some very young children that actually have severe AVN. So it's more than just wear and tear, if you will. That's something that goes on. One of the interesting things we're looking at is whether just the high doses of, or even regular doses of the same sort of treatments that we give patients that are much, much older and just have osteoporosis and fractures can be helpful. One of our researchers here is actually studying the effects of both zinc and on bone pain and
Oh,
bones because
interesting.
there's a lot of the enzymes that help regulate this relate to we have a lot of zinc requirements. And then Dr. Bempe Adesina up in Davis is actually starting an adult study using alendronate, which is what you give to someone with osteoporosis. There was a really intriguing small study in children that have bad AVN where it dramatically helped the pain. You have to be a little careful with alendronate because you can't give it long term for various reasons, but just as a idea of how we can interrupt. And remember what I said, we're starting to realize that the same signals that tell a bone to grow are the ones that signal pain and deepen the bone. And so how do we help one without the other? And that's kind of one of the
Oh,
challenges. And
wow.
eliminate seems to kind of duck that question because the way it works is it kind of blocks the breakdown part. So it does seem to kind of be a hit the sweet spot there. But obviously these are early studies, and part of what we're doing with this is getting people interested in doing more detailed basic science work to really understand this, so we can actually not just keep throwing things in that we hope work and to see how it goes and actually be able to focus. So yes, for the AVN, we have often the surgeries work really well. So I hope yours did. And we've had a lot of people get better with that. So just for now, that's kind of where we are. And that's actually one of the pains that doesn't get better after transplant. If you had bad AVN going into it, you're gonna have your bone may not worsen, but it's not going to get better from the transplant or gene therapy. And so we still have to make sure we have some help for those folks.
Wonderful. Um, I have a couple more questions. Do you have the time, Dr.
Sure, yeah,
Hager?
I was
Or
looking at, I'm starting to see them too. Just to let
okay.
the audience know, I've never used Instagram before, and Mr. Mel was
He's
showing me
doing
how to get
great,
on, and
right?
I'm starting to see all these questions pop up.
He's
And
doing awesome.
so, so if you want to ask them, I see a couple here. Um,
Yeah, somebody asked, is there a permanent cure to sickle cell disease?
the short answer is we don't even know what a cure looks like. And the reason I say that is even with gene therapy or,
Oh,
um,
we lost you. All right, I
really?
cannot hear you anymore.
Oh, someone's trying to call. Let me knock him out. Are you there now?
Oh, yes, I can hear you now.
Yeah, someone tried to call on my phone and
Oh,
somehow
okay.
did that. Um, we don't know what a cure looks like because even with gene therapy and most transplants, there's still a subset of sickle cells that are floating around. Hopefully, it's low enough or has enough fetal hemoglobin that's been induced in it to really not cause trouble. And for the couple of years that we've been doing this, it looks good. But long term, we don't know if these small cadres of sickle cell are still doing some silent damage over time. And the other side of the coin is that currently with the studies, they still have to do what's called, they still have to really suppress the bone marrow. So they really have to give a really toxic chemical. Currently, most places are using,
Busulfan?
yeah, busulfan. And then, so with that, long-term effects of that are still not quite known. They're using a whole lot less than they used to, but these are things we need to see down the road. And then the third thing is that the body is really clever about protecting its DNA. And in the past, have been other treatments where they've changed the DNA and the body somehow figured out how to change it back. So yeah, so
Really?
we haven't
Oh,
seen that yet, but
wow.
these are things we're just curious to see over time.
And only time would tell for something
And only
like
time will
this.
tell. And that's
Wow.
part of the interesting thing. Also to let the audience know, they're working on some other therapies that probably won't need genetic therapies that may not need the busulfan or the chemotherapy, and almost is like an injection. But again, this is done early. They've been doing it in mice, and Stanford's had done it to, has been trying to start a trial with adults, but they're still using a little busulfan. They're not quite to where they want to be with this yet. They're still a little concerned, a little edgy about not using it at all, but still we'll
Yeah.
see. But the idea is that there are other ways they're thinking about doing it. So I guess if you think about a cure, it would be to switch the sickle gene back to a non-sickle gene, and that would be
Yeah.
a cure in all the DNA. And that's
Is that the only way that we could really call sickle cell a cure? Is switching that gene back?
Again, how you want to define it. Now, if we say that is, there's not enough sickling to really cause trouble for someone's lifetime, you don't need medicine or anything else, but you still have the
Yeah.
gene, I'd call that a cure. Definitely,
Okay.
or at least, it's such disease control that if you don't have to think at all about your disease and doesn't affect your lifestyle and
Yeah.
what your hopes and dreams and what you want to do with your life, then heck yeah, I'd take that as a great win. I got lots of other things to do. I'd love to get out of the sickle cell business, but we're not quite there yet.
No, you're ours forever.
Uh, and so it's part still, and I guess you're talking about whether it's a genetic cure or a clinical cure. or something we don't have to, really barely have to think about. And so the short answer is we're getting close. And just to let the audience know too, there are two new meds that are coming out. One's been already approved for thalassemia, and they're looking at it for sickle cell.
Yeah.
And again, these aren't cure, but it really does seem to make the red cell a lot healthier. And I can easily see using that like in combination with hydroxyurea or even by itself. And most people, the hemoglobin goes up, and just the health cell seems really, red cell seems really good. Now it's not, it's not a complete cure, but again, these are many things beyond gene therapy or transplant that really do seem to move the needle and improve quality of life for a lot of folks. So we'll just have to
Yeah.
see. There may be some other just oral medications like many things. I'm always struggling to find a good analogy for another disease that's not too horrible to talk about, but maybe something like, you know, bad blood pressure, where sometimes you can give it a couple of different medications, then it actually works pretty
Mm,
well.
yeah.
And but
Yeah.
then you have to think about it. It's really probably not going to bother you in your life, but you have to be on some medicines. So I guess in my mind, I think a cure is one and done. To get something and you don't ever have to think about it again. But even controlling a lot of the long-term effects, because as the audience knows, I mean, as bad as pain is, the main thing that shortens life, unfortunately, and also quality of life is end organ damage, heart, lung, brain, and
Yeah.
kidneys. And anything we can do to help protect those over time is really going to be important for quality of life and so people do what they want to get done, what they want to do in their lives.
Yeah. This is a question I've never seen come in before, and I don't know what this is, but maybe you can help me out with this, Dr. Hager. What are the risks of taking alendronic acid long term? Do you know what alendronic acid is?
Ellen Try, I think it's Ellen. Oh, it's. I do think they're asking about one of the bone medications. Is that? I
Is
think
that what it is? Let me see. If you ask that question, can you let us know
I'm looking it up real
what the
fast. Make sure we're on the same
alendronic
one.
acid
Yes,
is?
I love questions like this.
Maybe I can look it up here real quick.
Yeah, alendronic acid.
It sounds like it's a
Yeah, yeah, that's one of the bone
oh, it's
medications. It's a
it says
bisphosphonate. That's what I thought it was.
biphosphonate
Yeah. So
medication used to treat and prevent
yeah,
osteoporosis
yeah,
and
that's the one. And
the
actually, that's one of
Graves'
the ones that are
disease.
that often are used, and I'm thinking about using short term.
I'm not
So to answer the
sure.
question, after about 3 to 5 years, you actually start
Is
getting.
it sickle cell related? Are you taking the alendronic acid because of sickle cell? Are you taking alendronic acid because of sickle cell? It sounds like it's for
Yeah,
osteoporosis.
they usually give it for 3 to 5 years and then take a break because after about that time, it has affected the way that the bone. As Cassandra knows, and once I start talking about everything. But the bone is actually very dynamic. It's always breaking down and rebuilding, even when we're older. And so it's not like it just suddenly made and suddenly going away. And since you are influencing how that interaction is between the breaking down and building and actually moving it to the building, it actually starts building bone, but not the completely normal way. Anyone that's been on alendronic acid or any of the bisphosphonates for several years, often you can see changes on X-rays, the bone X-rays, and you can actually go, they've been on bisphosphonates. Most of that's just benign and just a change, so it's not anything you're worried about. But there are reports, especially if people have been on it more than 5 years, of what are called pathologic fractures. It just changed the bone enough that they're just not built the same way. And one of the things that um, uh, Dr. Adesina is trying and Dr. Fungs are trying to look at is that relationship between the bones because the bones have a hard outer contact and a very spongy inner one called trabecula, and that's actually where the strength comes from and keeps you from fracturing, and how all this actually affects those two. So as general guidelines, you don't want people on bisphosphonates more than 3 to 5 years because of the risk pathologic fractures. And then the fact that it may not be even that much more helpful beyond that time anyway. So the risk benefit really starts to change about what's on it. But for the first few years, it's great. So yeah, if you're on it, that's one thing. If it's been 5 years, you should talk to your doc just to make sure that they're monitoring what they need to monitor if they feel like you still need to be on it.
I know Some of Dr. Gupta's specialty is, oh, there's a specific term where she's talking, I think they're called CABs or alternative medications. I think she's done research in turmeric, for example,
Yes.
and sickle cell and pain.
And that's
Um,
actually one of the grants we're looking at is to actually
okay.
study it. And it's uh, a compound called curcumin. There's a published study on it
Yes.
that we don't believe because it's way too good. It's like you take a little bit of this and you're cured. But they did it in mice. I guess we've cured mice so many times from sickle cell that if we were mice, we'd be good. We still think it's a really powerful and interesting idea. I'll write it with people all the time where the mice look wonderful and people will get some results, but they're just starting to move it into people phase of human studies. So we kind of see, but yeah, she's very interested in this, and we are too. She's actually been looking at all, a lot of her work. She's at University of Irvine now, University of California,
Mhm.
Irvine, is looking at all the other factors we talked about. One of them are like mast cells that really seem to be involved with pain. And these are the sort of things that we're trying to figure out how to pull together and actually work with to kind of help long-term pain control.
Yeah, that's big in the community. A lot of people are interested in, kind of using nutrients and
Yep.
supplements to manage sickle cell and their pain. And somebody even talked about beetroot juice. Any other studies that you're aware of?
Let's see, what the most interesting ones lately have been, one was just actually related just to good old zinc. Because if you get a high enough level of zinc, then actually it starts to affect how your bones it actually improves bone formation. So when we actually do one of the things that's been very understudied, and I do appreciate your website talking about nutrition, is that very few Americans, probably myself included, are probably getting all the good foods we need. Our normal fruits and vegetables and everything is probably a little underpowered because our bodies are really built to
Yeah.
run on that. And even though it does the best as can, if you're low on several of the nutrients, you're probably long term there will be some sort of effect with that. And it does seem to be that our patients that do seem to have a healthier lifestyle have a whole lot better quality of life. Still
Mm.
have issues at times. So one of the questions we always go
Yeah.
over with our folks is, how are you eating? How are you exercising? How are you sleeping? Because that's kind of like a bedrock for everything else. And if we can help them get that done, then that's a really good start to then working on everything else.
Wonderful. Well, I think that's all the questions we have for today. And thank you so much for taking the time,
Oh no,
Dr.
thank you so much
Hager,
for
coming
inviting me.
on.
I really appreciated that.
We're really excited about the work that you're doing with the study, and the study is called SCDPain. There was an acronym
Yep.
for it.
That is
What
it.
is the
That is the
acronym?
acronym. The whole title is Sickle Cell Disease, Pain, Analgesia, and Integrative Network.
Okay, okay. It's
Uh,
integrative medicine. That's what Dr. Gupta does,
yeah,
integrative
yeah,
medicine.
yeah. And
Okay.
she's all over this.
Yes. Okay. Well, wonderful. Hopefully that answers a lot of your questions, and we will be on the lookout. Is there any preliminary data that comes out in the meantime, or any way that we should engage as a community for this particular study?
Probably what we should do is regroup in about 6 months. Because remember, what we're doing is we're not actually doing the studies ourselves. We're trying to pull
Yeah.
different people from different groups that really usually don't talk to each other to have a common interest in sickle cell pain and then start a study.
Yeah.
So our goal is not to actually do the study, but to try to pull in people that hopefully can help us improve care that really haven't thought about it before.
Okay.
So, we can definitely give an update like in 6 months on where things are.
Absolutely. Well, thank you so much. Thank you all
Thanks.
for
Yeah.
joining. Happy Friday and have a wonderful weekend ahead.
Thanks, everyone.
Thank you. Bye. I'm gonna end.